Welcome to the 7th installment of COVID Billions, brought to you by Gynaco Online News. I'm your reporter, Yusuf Taylor. On Saturday, 16th May 2020, the Gambia's Health Minister, Dr. Samateh, shocked the country when he reported to Parliament on the scale of corruption taking place in his ministry.
So instead of us to deal with the response to COVID-19, strategizing, develop the policies, we deal with allowances and the allowance list and this and that and that.
We visited Gambia Participates, an accountability watchdog organization who published a report in late April titled Corona, the Gambia and the Millions. The report, which tracks coronavirus funding in the Gambia, contained a section of the allowances debacle revealed by the health minister in Parliament. We meet with Mr. Mar Nyang, the Executive Director of Gambia Participates, to get his reaction to the health minister's corruption revelations.
I'm just happy that he has vindicated our report because the things that he have stated at the National Assembly is the news to us. We've already unraveled most of the things that he has said. In fact, if not all, in our report on Corona, the Gambia and the Millions. So it's actually in the news to us if you read our report.
But the Minister of Health had more to say.
When we talk about these things, it is not the majority, it's just in the minority that do some of these things. Now, that minority provided a list. In fact, when you look at the list and the estimates, it consumed almost the entire $500 million for allowances. That was the suggestion. Of course, we wouldn't accept that. We looked at the list. There were names of over 300 volunteers. Nobody knows where those volunteers. That means they are not working in the health sector. So if they are volunteers, remove all the volunteers. Bring the list of the core people. The list of the core people was brought. We saw names appearing in one section and another and another and another. Then I said no again.
Having written about the allowances debacle, we asked Gambia Participates about their encounter with frontline staff when they went to visit the various health facilities.
First, we spoke to stakeholders who were responsible for the preparation of the allowance list, and they confessed to us that the allowance list was, it was a fraud list, I can put it that way, where ghost names were included in those lists, over 1,000 names in that list, and when it was submitted to the Ministry of Health, it was rejected, and another one was submitted and it was rejected. As a result, there was a delay in the payment of frontline health workers allowance. So this is something that is repeating itself. It has been practiced in the Gambia since the former regime and is still manifesting itself with this new regime. So it's the same people that use systematic way of illicitly acquiring public wealth through adding names. And in fact, the name that they have added is not only ghost names, but some of the names are names of their friends, their family members, and their wives.
Some facilities were putting in their friends, their relatives, to be in that frontliner.
The minister shrouded his report in mystery when he said this.
Middle-level people who have been spending monies in here, building homes that 3, 4, 5 big-story buildings in town in this ministry, they are there. Now, I'll give you an example, a very sad example. If a former minister could call a program manager as recent as 2-3 weeks ago to say to him to send him fuel coupons, then we have a problem in this country.
Purchase your dream 3-bedroom home today at Mamuda for less than $3 million, only from Redland Capital.